Okay, this is the chapter of cellular injury. So if the adaptive capability is exceeds, then the cellular injury develops. So cellular injury of two types, reversible and irreversible. So if the adoption if can be capable, if the cell can go for adoption, if the stress is so severe, or they can directly go for cell injury. It happens in the, if for example if the heart is not receiving oxygen, then they will go for cell death immediately, and they will go for myocardial infarction, that is necrosis in the heart muscle. So there are two types of cell injury, reversible cell injury and irreversible cell injury. So reversible cell injury means, remember, the membrane should not break. So they should not progress to severe membrane damage and nuclear damage. So then if you give back the oxygen, then they can come back to normal. So that is reversible cell injury. If the membrane breaks, then they will go for irreversible cell injury, then they will lead to cell death. There are two types of cell death, necrosis and apoptosis. So what are the cause for cell injury? The most important cause is hypoxia, and ischemia is the most important cause for hypoxia. Understand, ischemia means loss of blood supply to a tissue. So sometimes the chemical agents can cause direct cell membrane damage, leads to cell death. The other causes which is very important are radiations and infections. So when the cellular response to injury depends upon the nature of the tissue. For example, if the cell has lot of glycogen, for example skeletal muscle, they can survive for 2 to 3 hours, whereas the cardiac muscle can survive for 30 to 40 minutes because they store less glycogen than compared with the skeletal muscle. So what happens? First they affect the mitochondria, oxidative phosphorylation, and they will decrease the ATP. Then they will affect the cell membrane. Because of cell swelling, the ribosomes comes out of the endoplasmic reticulum, that will affect the protein synthesis. Then the lysosomal enzymes comes and they will destroy the cytoskeleton and the DNA of the cell. So this is happens when there is ischemia. The mitochondria is first affected. Okay, when the cellular injury happens, when the hypoxia comes, the first thing gets affected is oxidative phosphorylation. That will reduce the ATP, and these are the things happens. So they go for anaerobic glycolysis and they will increase the lactic acid, that in turn will decrease the pH, and because of that the sodium pump channels are opened up and they take more calcium, sodium and water, and they go for swelling. Then there is a detachment of ribosomes that will inhibit the, that will stop the, decrease the protein synthesis. So the increase in cytoplasmic calcium is very important because they will activate the enzymes phospholipase, protease and endonuclease and ATPase. Okay, so the cytoplasm calcium is needed to activate the enzymes, and they also needed to act. Sometimes the caspase gets activated, they will go for apoptosis. So if the mitochondria releases more hydrogen ion, they will go for necrosis. If the mitochondria releases cytochrome C, then they will go for apoptosis. Okay, so this is what happens if the calcium comes. If the calcium comes, these are the things will happen. How the calcium comes? It can come out of the mitochondria, it can out of the endoplasmic reticulum, or it can come outside the cell. So in the end they all increase the calcium in the cytoplasm, they will activate these enzymes and the whole cell will go for damage. You should know which enzyme damage what area. Okay. So the protease damage the cytoskeleton and endonuclease damage the nucleus, phospholipase damage the membrane, and ATPase will break the ATP. So any damage which directly affects the DNA, that will go for apoptosis. Example, radiation injury and oxidative stress that will make the cell to go for apoptosis. So this is the summary of the reversible and irreversible injury. So what happens is, when the cell is swelling, if you give back the oxygen, it will come back to normal. If you are not giving back the oxygen, then the membrane ruptures happens. If membrane ruptures, what will happen? So they will, all the enzymes comes out, and they will completely get activated because we have calcium in the cell, and they will degrade the cell. Okay, so this is happens, and then they will become irreversible cell injury and they will go for necrosis. So now free radicals or the chemical species, they have single unpaired electron in an outer orbit. They are extremely unstable and they will try to take electron from other chemical substances and they produce a chain reaction. So one such kind of free radical is reactive oxygen species. They are oxygen derived free radical and they are produced normally in cell during mitochondrial respiration and energy production, during energy production. So they are removed, they are degraded, removed by the scavenging system. That scavenging system name is antioxidants. Antioxidants. Okay. So if antioxidants is reduced or reactive oxygen species is increasing, that is called oxidative stress. This oxidative stress happens if there is radiation or during aging or during ischemia-reperfusion injury or in inflammation. Okay, so the potent antioxidant is glutathione. Okay, glutathione, because they have millions of electrons outside and they like donating the electrons. So now coming to the ischemia-reperfusion injury, when there is a ischemia, if you give back the blood, and the blood also brings lot of new inflammatory cells, if they are active, and they will increase more damage, and that damage is called ischemia-reperfusion injury. So now coming to the morphology of necrosis, and necrosis is a form of cell death and it is due to what? Degradative action of the enzymes, and the necrotic cells will become more eosinophilic, more pinkish, because of more protein. Then they destroy the complete nucleus and they become completely pinkish. So these are the normal area. This is necrotic. So this I explained what area stained in hematoxylin and eosin. So what are the patterns seen in nucleus? First they go for karyolysis, then they go for pycnosis, then they will go for karyorrhexis. So there are different types of necrosis. The coagulative necrosis is seen in all organ except in the brain. What is the main thing? They maintain the architecture. In liquefactive necrosis, they will become like a liquid mass and it happens in the brain tissue, central nervous system. And gangrenous necrosis, it is a clinical term. It happens due to loss of blood supply, and first they will be dry because it is coagulative necrosis. This is dry gangrene. When they are infected by the bacteria, then they will become liquefactive, then they are called wet gangrene. If they are infected by Clostridium perfringens and they produce gas, then they call gas gangrene. So caseous necrosis is a cheese-like necrosis, is formed due to tuberculous infection. Fat necrosis usually comes when there is acute pancreatitis that releases the lipase and that will destruct the fat. It usually seen in the alcoholic patients. And if the calcium gets deposited, that is dystrophic calcification, and the process sometimes we call it as fat saponification, soap production. And fibrillar necrosis seen in immune reaction, it involves the blood vessels. So apoptosis is a path of cell death which can happen in a normal event, and it is called programmed cell death. In meaning is apoptosis falling off. See, for example, in embryogenesis apoptosis happens. It's a normal event. But in radiation injury or in viral infection or in free radical, it damages directly the DNA and they will make the cell to go for apoptosis. So there are two pathways which stimulate the cell to go for apoptosis. One is intrinsic, other one is extrinsic. Intrinsic pathway is called as mitochondrial pathway. The mitochondria releases the cytochrome C and they will activate the caspases and they will become like apoptic bodies, and it is removed by the phagocytic system. So we have two types of molecules: apoptic inducing molecule and anti-apoptic molecule. So this has to be in balance. If anti-apoptic molecules are increasing, okay, they will not make the cell to go for apoptosis, then they will become as a cancerous cell. So there are death receptors outside that will stimulate the process of apoptosis. Such receptors are TNF receptors and Fas ligand. So coming to the necrosis, see, necrosis happens when there is damage to the membrane, the enzymes leaks out and they will go for necrosis, and they have to remove, they go for inflammation, and it is always a pathological process. Whereas apoptosis, if anything DNA gets for damage and the cell will go for apoptosis and the nucleus will be removed first. And remember, they will not create inflammation. No inflammation in apoptosis. No inflammation in apoptosis. Okay. The best examples are viral infections like hepatitis virus, radiation injury. Alhamdulillah.